welcome Dr. Marjorie Dixon, women's health specialist, fertility expert. So talk a little bit about a story that we've been seeing a lot about in the news. So genetically blessed Halle Berry comes out and says, not only do I have the perfect body and the perfect life, I am pregnant again. So she is pregnant at 46 years old, which is interesting only in that there are now a lot of women out there thinking, hey, I can get pregnant at 46 years old.
Exactly.
Because you're seeing that. You're seeing the spillover.
I see it all the time. I see the spillover. I mean, in a city like Toronto, the average age of my patients is a little bit older.
Yeah.
But I'm seeing more and more 43, 44, 45-year-olds coming in for consultation and wanting to get pregnant. And so that's where we have to have kind of a sobering conversation. We've talked about our ovarian reserve and diminishing as we get older, but it's quite significantly diminished after age 43.
Okay, so when does the diminishment really start?
Age 41. After, well, a little bit. Your capacity to conceive easily diminishes after 32.
Right.
And then quite significantly after 40. So much so that even with assistance, so IVF, all the fancy stuff that I can do, people's likelihood of getting pregnant after 43 is less than 1%.
Less than 1%?
Yeah, less than 1% with in vitro.
Okay.
1 to 5% if we're being generous.
Yeah.
So if you look at the recommendations of our governing bodies, between ages 40 and 43, you know, it should be straight to in vitro fertilization, and that with a cautionary tale of maybe 20 to 30% maximum chance per cycle of getting pregnant.
So you're saying go straight to IVF if you're over 40?
If you're over 40, just because of the fact that it's your best likelihood of getting pregnant.
Yeah.
But even then, when you get pregnant, there are risks after 40. And when you get pregnant after 40, the quality of your eggs is lesser. So even if you do get pregnant, your risk of miscarriage is great, and your take-home baby rate is much lower.
So why, Marjorie, when I hear people talking all the time, there's always someone saying, oh, but there's so many more women in their 40s who are getting pregnant. Is that real, or is that making stuff up?
No, there's so many more women having babies in their 40s because of people like us. So they require assistance, and then sometimes they aren't getting pregnant on their own, even with their own eggs. They are having other options. So when I see patients and I talk to them about the low likelihood of pregnancy, then I say, well, these are your options. There is, you know, do nothing.
Right.
There is adoption. We can try with your eggs one time if it looks like you have good reserve. So you have to look at all the criteria and work them up initially, and even say if they are a candidate to try once with IVF.
So you can figure out if we have a good reserve of eggs?
Exactly, a good reserve of eggs.
Machines that will see
well, not quite special machines, but blood tests. We monitor people for a month. We see how they ovulate. Some women have an FSH. We've talked about this before, follicle stimulating hormone level that's very high, almost in the menopausal range. It's not worth them, even if they show up when they're just 40. It's not worth even trying.
Okay.
But then there is something called egg donation.
Okay.
So this is where patients will come with a sister or a niece, someone who's much younger, in their 20s or early 30s, less than 33. My cutoff for egg donation is age 33.
All right.
And what I do is I work them up to make sure that they're a good candidate as well.
And what do you mean by work them up?
So
like
I check their ovarian reserve. So that's where we do those tests. There's the AMH, the day 3 FSH, how their brain and their ovaries communicate through one cycle. I just watch them. If they're good to go, then we can use them as an egg donor. So I would stimulate them and then prepare the uterus of the intended parent or the recipient who's in her 40s. And then once the eggs are ready, retrieve them from the younger person, combine them with sperm or donor sperm for this intended parent's uterus, and then transfer the embryo back into the uterus of the recipient.
That's
and then
amazing.
they can be pregnant. The likelihood of the person being pregnant is really based on the age of the egg donor.
Okay.
So that's why women who are older can still have babies, even if their eggs are not so good, because they can get an egg donor to give them eggs that are good.
Now, if you get that egg donor, the younger egg, and you get it put back into your womb, but you are 45 years old, are there still carrying problems?
There can be, but more than the carrying problems is the risks associated with being older having babies.
And what are those?
So you can have hypertension, diabetes, stroke. So even if the embryo can be carried and people can get pregnant with 1 or 2 babies, because if you end up putting 2 embryos, the likelihood of twins is almost as high as 28%.
That's why everyone in Hollywood has twins.
Well, yeah, maybe. I
mean,
make
sorry,
a comment,
I'm just throwing it out there, but every other week you hear, oh, Mariah Carey's having babies, and all these people are in their 40s.
And you know what? I appreciate those celebrities who are forthcoming. So who say, you know, it was very hard for me. I went to see a clinic. I had IVF 6 times. Celine Dion is a big proponent of fertility therapy, not because she wants everybody to get it, but she wants people to be realistic about what the likelihood of them conceiving at an older age is. But there are also risks. As I said, the risk of stroke is there. If people have other medical problems, as we get older, we're way more likely to have other medical problems creep up on us. And after 45, I make everybody have a specific medical evaluation and assessment with a high-risk pregnancy specialist. And they'll all be happy that I actually said that out loud, because we can do these. Just because we have the technology to do this doesn't mean that it's a good idea for everybody to do it either.
Okay.
And you know, there is in Canada something called the Assisted Human Reproduction Act, and there are specific stipulations in that people need mandatory counseling, implications counseling. What's this going to mean for you? How will it affect you as a couple? And then also you need legal counsel, independent legal counsel, because if you have donated your eggs to your friend, you need to have a very specific legal contract drawn up by a specific lawyer that deals with these things. You can't just go to some lawyer and get a contract signed up, because it can have implications for later in life. If you lose your job and there's an egg donor out there that you know that was your friend's sister, and she has a good job, what prevents you from going after her for child support? Like it can get very complicated. So that's why the doctors will say, well, yes, we can do this, but you have to have independent legal counsel, you have to have a medical assessment, you have to make sure that you've considered all that's involved in this, and then we have to make sure that we do it the right way.
Very interesting. A lot of issues to think about there. Too bad everybody is not completely forthcoming. This is a good conversation to have.